Good evening and welcome to another edition of the Borno Health Update. I'm your host, Ibrahim Amarawa. The program is designed to shed light on the remarkable stride being made in our healthcare sector under Governor Zulum's visionary leadership. In the program, we focus on the transformative efforts spearheaded by Professor Baba Malam Gana, the Commissioner of Health and Human Services, who is driving innovations and resilience in our healthcare system. The historic commissioning of the Eye and Dental Hospital Monguno, as well as College of Nursing and Midwifery, marks a significant milestone in Governor Zulum's 25-year development plan, which is founded on providing comprehensive health care. These legacy projects provide clear evidence that the 25-year development plan is being successfully implemented. During the commissioning ceremony, Governor Zulum stated that these institutions fulfill his promise to deliver not only critical healthcare services, but also educational facilities to train future generation of healthcare workers.
It is my singular honor and privilege to be in Monguno today, specifically to commission 3 landmark projects. One, the Dental Hospital Monguno. 2, the Eye Hospital Monguno. And then the last but not the least is the School of Nursing Monguno. Borno State was created about 50 years ago. But unfortunately, the state has only one dental hospital, public dental hospital, and one public eye hospital, which are domiciled in the headquarters of the state. On assumption of duty as the governor of Borno State, we promised to the people of Borno State that we shall bring affordable and quality healthcare delivery systems to the doorsteps of the communities. In this regard, Borno State government has decided to establish dental and eye hospitals in southern senatorial zone as well as in the northern senatorial zone. Consequently, we have established and commissioned dental and eye hospitals in southern Borno, which was specifically located in Biu town or Biu local government areas of Borno State. Today we are here to commission that of northern Borno here in the historic city of Monguno town of Monguno local government area of Borno State. And to the glory of God and to the benefit of this community, few minutes ago we have commissioned the Dental Hospital Monguno and Eye Hospital Monguno. We have also plugged up the provision of free services to cater for the needs of about 5,000 persons from northern Borno, for them to be provided with free eye surgeon. And I want to recall with nostalgic what we saw this morning in the eye hospital, where a patient narrated that he was blind for about 10 years because of cataract only. And today, to the glory of God, the man would inshallah see the 4 walls of the eye hospital. Glory be to Almighty Allah for giving us the opportunity to commission these landmark projects. We are also here to commission the School of Nursing here in Monguno, because what matters is not only the construction of the facilities, but the human resources for health is key ingredient that would ensure sustainability of all health projects in the state.
The commitment of Governor Babagana Umar Zulum to ensuring comprehensive infrastructural development throughout Borno State is paramount. Central to this vision is his plan for Mongono to remain at the heart of northern Borno and evolve into a major urban center. To that end, Governor Babagana Zulum has approved an allocation of 3 billion naira for the construction, upgrade, and re-equipping of Mongono General Hospital to a specialized status. This significant investment will not only enhance healthcare delivery, but also establish a vital training institution for the next generation of medical practitioners.
This School of Nursing will train our younger ones so that they will become nurses and midwives, thereby providing the needed manpower not only to northern Borno but also to southern Borno, as well as other states in the Federation. I want to assure you that the teaching accommodation would soon be provided to all these staff so that they will live comfortably. However, as an interim measure, the Commissioner for Local Government Council as well as the local government chairman of Mongono local government should put heads together and identify some edifice within the town so that Borno State government will take over this edifice on a rental basis, pending the completion of new housing estates to these doctors. Commissioner for Local Government also have to identify a site for construction of not fewer than 100 housing units here in Mongono immediately, so that these personnel that are working in Mongono, especially the medical personnel and teachers that are living in Mongono, shall be given a BPT accommodation. You can sit down. And inshallah, we shall commission it, plug up these projects very soon. Furthermore, very soon, we shall plug up the construction of a repeated specialist hospital in the General Hospital Mongono. The BOQ for this project has been concluded. The project will cost the Borno State government about 3 billion naira, the construction only, without furnishing it, without equipping it. And inshallah, this project will soon start in Mongono town, and they will be fully equipped with state-of-the-art facilities like MRI, CT scan, and others that are available with Metropolitan Council, so that the 10 local government areas of northern Borno need not to go to Maiduguri for their medical treatments, inshallah. And I want to assure you that on or before the end of next year, all these projects will be commissioned. What would happen after the completion of this specialist hospital? This hospital that is being run here now in Mongono is now a general hospital. But once this hospital is upgraded to a specialist hospital, that means residency trainings for medical doctors can be undertaken here in Mongono, so that the major problem that we are facing in this region of the state, which is the gap in human resources, can be reduced to the PRS minimum. I want to call upon the stakeholders of these areas, local government, and in particular, the chairman of Mongono local government area, and indeed the stakeholders, to maintain these facilities. The Nigerian Army, the divisional police officer, the civil defense, as well as our gallant civilian duty of hunter the vigilante, should secure these 3 landmark projects, which is very important. The chairman of Mongono local government is doing very well. But I want to tell you again that you have to maintain these 3 edifices.
That was the workaholic and people's governor that we are all proud of. In his welcome address, the Commissioner for Health, Professor Baba Malamgana, stated that the ongoing initiatives aimed at development of Borno State, especially in the healthcare sector, are a profound source of pride for all in the state. Furthermore, Professor Gana expressed his appreciation for the significant investment and support the healthcare sector is receiving under Governor Zulum's visionary leadership. He urged parents and caregivers to seize the unprecedented opportunity now available to them to achieve universal healthcare coverage.
Today is a milestone we gather not only to celebrate a building which is in front of us here, but to embrace a vision that places health and well-being of our people at the very center of our development. The commissioning of the College of Nursing and Midwifery is more than a ceremonial milestone. It is one of the most strategic and forward-looking investments this administration of His Excellency can make in the future of healthcare in Borno State. While modern hospitals and well-equipped clinics are vital, it is the skilled and compassionate hands of nurses and midwives that truly save lives, comfort the sick, and provide hope to families in their most vulnerable moments. Our state, like many others across the country, faces significant challenge in the area of maternal and child health. Too many mothers lose their lives during childbirth, and countless newborns face preventable complications due to shortage of trained and competent healthcare personnel. These tragic losses are not just statistics. They are deeply felt in every family and every community. It is for this reason that the establishment of this college is crucial by training a new generation of nurses and midwives. Monguno happens to be amongst the 13 local government areas where the burden of maternal and neonatal mortality is high in Borno State. So technically, Monguno is amongst the Mami State as tagged by the Federal Minister of Health. This institution will serve breeding ground for skilled, dedicated, and highly trained healthcare professionals who will become the backbone of our healthcare system. Every student who walks through these halls will carry with them the potential to save lives, reduce maternal and infant mortality, and improve the overall quality of care across our hospitals, clinics, and communities. By producing competent health workers who understand the specific needs of our people, will ensure that no mother, child, or family has to suffer due to absence of qualified caregivers. However, the success of this endeavor is not solely in the hands of government or administrators. It requires shared commitment from the entire community. As His Excellency has often emphasized, I call upon every parent, guardian, and community leader to support and encourage our youth to take advantage of this extraordinary opportunity.
Dr. Shatima Maina Muhammad, the Permanent Secretary of the Ministry of Health, and Professor Abubakar Ali Kullima, the Chief Medical Director of the Hospital Management Board, joined the Commissioner in commending Governor Babagana Zulum's significant investment in the healthcare sector and urged the community stakeholders to safeguard the infrastructure.
This is a momentous and historic occasion. One of the major challenges confronting the health sector in the state and universally is human resource in health. And it is to address this gap that His Excellency the Executive Governor of Borno State, Professor Babagana Umar Zulum, established this College of Nursing and Midwifery in Monguno and Gwaza. Today we are witnessing the commissioning of College of Nursing and Midwifery in Monguno, which will go a long way in addressing the human resource in health challenge. The institution will train nurses, midwives, and other cadres of health personnel that will contribute to reduction of maternal mortality and then healthcare delivery in the state at large. So indeed, this is a very historic occasion. It's a legacy that will the people of Borno State will cherish for a long time to come. And again, additionally, we have the eye hospital Monguno and the dental hospital Monguno that are also commissioned today. They will provide this specialized healthcare service in dentistry and eye care. Honestly, Borno State is the only state that now has an eye and dental hospital in every senatorial zone. So we will continue to express our profound gratitude to His Excellency, the Executive Governor of Borno State, Professor Babagana Zulum, for this game-changing innovations and transformations of the health sector in the state.
And also the eye and the dental hospitals. The last time, as far back as 1979 or 80, when the eye hospital Maiduguri and the dental hospital Maiduguri was established by the then Governor Mohammed Goni. And if you look at, says the population of Borno is growing, and people cannot travel from all these far local government to come down to Maiduguri to access these services. So equally, it was in that wisdom, His Excellency, feel there is a need for us to establish the dental and eye hospital in Monguno, and then dental and eye hospital also in Southern Borno. So in all the senatorial zones, we have, School of Nursing, and we also have eye and dental hospitals, at least to cater for the large, population of patients who are in their need.
That was the Permanent Secretary of the Ministry of Health and the CMD, Hospital Management Board there, appreciating government investment in the healthcare sector. Well, we cannot end this week's episode without hearing the views of Monguno community stakeholders. Senator Tahir Muhammad Monguno and the chairman of Monguno local government area both speaks on behalf of the community.
Excellency, in my vote of thanks, I wish to state, without any fear of contradiction and equivocation, that your transformative leadership is unparalleled and unprecedented in the annals of history of Borno. This is clearly manifested by the fact that you have brought governance to the doorsteps of the people by bringing the dividends of democracy across all spheres of life, whether it is education, health, or otherwise to the doorsteps of the people. These are things that are there for each and everybody to see. We wish to most profoundly thank you for this leadership that is not only grassroots oriented, but jealously guards and protects the interests of the people at the grassroots by bringing the interests of democracy to the desktop.
Especially if I put up on Pimari, I'm kind of here, I want to come to the group.
Ani ba wani da wani kasa. Wani ne itari shimina, itari timina, itama kuma kola ne, raya karata ta karata. Na san da ya ta mutuwa da. Irin project ne ma da.
Sannan
Kuma
motar
wannan gwamnati
samun
sai saka da school mu
kullum
ai da bila ne mu na kawar da sanin kima kuma da shi contract
na
na
wanda ba
da.
ka
A euro bile da ba euro asirena insha Allah euro ba duwena. Duk amma da tare da ma da ma ya sako ma da ande a kwana da sa wanda sun dubla da dai kibu da assembly. Ya ma da sa wanda mu ne shi da dai honorable man da musamman da a kwana da suna duk dai ala yasa dai a support ke tara ne isa italiano ai sa detta sam ma so tara da kin ko ne ira ala yasa da mun gure ke ba ala da su ala da mari ala euro da sa.
Well, viewers, with this, we have come to the end of this week's episode of the Borno Health Update. Join us next week for another interesting segment. Until then, bye for now.